And I'm somewhat surprised sometimes when people, look at us like, we're from outer space. And they're like, what do you mean? We're kind of used to quoting, and, every 3 years we take it to bid or we do an RFP. Every 3 years we kind of see who comes back with the best numbers. And I'm not saying there's anything wrong with that strategy. I think we just don't think it's the best strategy. And at the end of the day, where we're seeing, I would say the potential clients and current clients that are having success is they're committed to this, not just at renewal, not just at bid time, not just at, hey, who can get us a quote, but they're really looking at this just like they do at any other line item in the P&L. They're looking at this just like they look at, supplies and labor, and they're saying, hey, how do we manage this? How do we reduce it? What are the things we can control? And I think when you look at healthcare that way versus, hey, let's go get a quote, it brings a lot, just lack of better words, a lot of peace, to leadership teams. And the leadership teams that buy into this mindset and they understand, okay, what drives our cost? I think that's the simplest form where you can start. If you haven't kind of had this deeper thought about healthcare and benefits, is what drives our cost. And there's going to be a couple things that make up that, your claims, your insurance, your risk appetite. Those things are going to drive your cost at the end of the day to the end user. But then understanding, okay, how are providers paid? How's a claim submitted at the pharmacy, and what happens? When you start going to that second level, then you start to see, okay, what's broken in the system? And some of that is clarity on options. How do you get to higher value, lower cost, better outcome? Some of that's competition in the healthcare space. Shopping for healthcare is unlike anything else today. It's tough. There's no place like Amazon where you can go on and click right knee MRI, left knee MRI, and right hip surgery, and it's a actual factual database that's easy to use for an employee. That does not exist. There's a lot of people saying they're doing it, and there's a lot of people that are making good direction there, but there is nowhere today like an Amazon of healthcare.
The question, would you ever look at your Amazon app, add a ton of things to the account, look at your cart, and there be a blurred out number at the total and just hit accept and order all the things? Yeah. No one would ever do that, but everyone does that.
Everyone does it. Myself included. I've got 2 little kids. We're at the hospital and doctor more than I could have ever imagined, and we had a significant hospital stay earlier this year. And I get why. It's an extremely emotional, extremely personal situation when people are going to the hospital or seeking care, and people say, hey, it doesn't matter. I need to solve for this. What happens with all those opportunities, though, when it does matter, and when you do have the opportunity to make decisions, and when you can go to a better outcome provider, better cost, higher value? What would happen if we just focused on those and said, hey, we can help you get to a higher value facility, better outcome for you as an individual, better cost for you, better cost for your plan? I think that today is what majority of employers that are bought into this are trying to solve for. And it's easier said than done. But at the root, you have to get employees engaged and get them to understand there are options. There are ways to get to that higher value provider. There are ways to stop once you're in a process, in a system, and say, whoa. Do I have options here? Can I go seek that procedure or that care from a different facility or a different system? Or wait, I've got a question. What's the outcomes of this provider versus another provider? How do I figure that out? There are things to do that. But I think today where most groups we talk to are, an employee has a card with a PPO network on it. They have access to 95% of providers, and they're able to start that care journey, and they don't have anyone to help them.
They have no idea if the provider they're seeing is the lowest quality, highest cost, or the best quality, lowest cost. Anyone would want to go to the highest quality, lowest cost provider out there. That's very. But how do you figure out who that is? And an individual who has a family, they're working, maybe they work 2 jobs even. They don't have time to shop for healthcare. And when their kid breaks their arm, and they need to go to the doctor immediately.
Yeah.
There is no time spent figuring out, okay, what doctor am I going to take my child to? And you experienced that having 2 kids. You just went right to the hospital.
Yeah.
Even working in healthcare, it's very normal to do that. But if you can somehow have someone intervene in that step where, okay, a claim is going to be filed, there's a pre-certification happening, how do we get this member to the highest quality, lowest cost facility? There are ways to do that, and they aren't as difficult as employers may think.